Hi, good afternoon, everyone. Today is Thursday, March 21st, 2024. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to today's General Ledger Supplemental Data Collection Template Training. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar: by computer and by phone. And if you look at the panel interface on your right labeled audio, you can click either computer or phone to switch for the best option. We will be recording the webinar and posting the session on YouTube and the DDA website. Today's PowerPoint has also been uploaded as an attachment and is available for you to download in the webinar panel. Questions can be typed in the question or chat box in the webinar panel, and the team will review and respond during the open discussion session portion of the webinar. We respectfully ask that all questions be held at that time. So now I'd like to introduce Elizabeth Peters, Special Assistant for DDA.
Thank you, Donna. And good afternoon, everyone. On behalf of the Maryland Department of Health Developmental Disabilities Administration, we would like to welcome you all to this afternoon's General Ledger Supplemental Data Collection Template Training. And with us this afternoon, we have our colleagues at Hilltop and Optimus to join us in conducting this training. So with that, I will turn it over to Caleb, who will kick us off with the training. Thank you, Caleb.
Thanks, Elizabeth. Hello, my name's Caleb. I'm a Senior Manager at Optimus, and we are assisting Maryland DDA with the rate review this cycle. I'm going to be talking about the General Ledger Supplement for the fiscal year 2026. This supplement is a data collection tool designed to assist us with the review of identified rate priorities to set rates for fiscal year 2026. So that would be July 2025 through June 2026. It is a supplement. We call it a supplement because it is an addition to the General Ledger template that all providers will be asked to submit by September 30th, 2024. The supplement is for the DAHAP providers and intended to provide some early look initial data and allow us to look at the particular rate priority, in this case, the productivity adjustment, which I'll talk about in a moment. Since it's a supplement and the fiscal year isn't completed yet, we're asking you to look back on the first 2 quarters of this fiscal year. So that's July 2023 to December 2023, first 6 months of this fiscal year. As I said, the purpose of this particular supplement is to look at the productivity adjustment that we are considering, that DDA is investigating. So if we could see the next slide, the productivity adjustment is intended to account for the fact that providers that service direct service professionals are not able to bill for the entirety of their working hours. There's sort of 2 impacts to that fact. There's a sort of a direct impact that if, for example, you one of your direct service providers is doing an hour of training, that means they can't bill for that, but you are incurring expenses for that person during that hour. But there's also it impacts the other components in adjusting how those expenses are calculated relative to the wages. So we account for the direct impact by having components to account for training and transportation and service closures. But there's a secondary impact where, because they didn't work a full 8 hours, we have to adjust each of the other components. And we do that by introducing a productivity factor that is their total hours worked divided by their billable hours, or alternatively, their total wages divided by their billable wages. Those in theory should come out to the same number, assuming that people are paid a constant wage during this time. And that gives us a factor. So for example, if someone works 8 hours a day, but they can only bill 6 hours, then we multiply their 6 hours by 8 divided by 6, right? Which in that particular example would be 1.33. So that gives us a productivity adjustment. So in the past, we have not had the data available to calculate this, and so we have not used this approach in the model. So we are investigating using this approach, accounting for this particular factor in this way, but it is necessary that we collect this data. So in order to collect this data, we're sending out this general ledger supplement, and so I'm going to walk through the data collection process. The next slide. If we go to the next slide. So for this rate cycle, we are piloting this in the day habilitation services. We're going to start with the day habilitation service where there's been identified that it requires an investigation. We're asking all the day habilitation providers who provided services during the first 2 quarters of fiscal year 24, that should be July. Anyways, the first 2 quarters of fiscal year 24, there's a typo in there, are required to submit data on both billed and unbilled time. And we're also asking for wages for the direct care staff. And the reason for that, just briefly, is that in the past, we have used higher estimated wages to account for this productivity factor. And if we introduce a productivity factor, then the estimated wages may also need adjustment. We are expecting, it is expected that everybody all day have providers will fill out this general ledger supplement. If we don't receive sufficient data or data that is complete and reasonable and accurate, then we're not going to be able to, we won't have the necessary data to make an adjustment this cycle. So we're asking all day have providers to provide this data for the first 2 quarters of fiscal year 2024. That is July 2023 through December 2023. So that's sort of the rationale, what we're doing and why we're doing it. And I'm sure you all, and I see there's over 75 attendees, I'm sure you all have questions about how we're doing that. And so we've sent out a general ledger supplement for you to fill out, and I'm going to pass you all now to Marianne Mood at Hilltop, and she's going to walk through the actual supplement and answer any potential questions you might have about how to fill that out. Thank you. And if you do have questions, if you need references, they'll be here in the handout. You can see the links as necessary. Sorry. Marianne?
Caleb, can you guys hear me? Perfect. So I'm going to go ahead and pull up, I actually have a series of documents that I'm going to go ahead and pull up right now. You should be seeing the general ledger supplemental template on the screen. I know it's a lot to try to show on the screen, so I will do my best to make sure you guys can see what it is when I am specifically talking about a specific point. So again, I'm Marianne Mood. I'm a senior policy analyst at the Hilltop Institute. I am part of our DDA rate team. If you can hold off on any questions you have until the end or put them in the chat, and then we will try to address them as best we can at the end of the training. So as Caleb noted, this is the general ledger supplemental template that we're requesting all DayHab providers who provided dehabilitation services during the first half of fiscal year 24 to complete. So that's again July 1st through 2023 through December 31st, 2023. I know folks may still be billing in both systems, PCIS2 and or LTSS Maryland. The template, just as the general ledger template does, the template does permit you to be able to enter those costs and hours and wages for both systems or for either system. We have already received a number of questions in our DDA rate email box regarding what do we mean by DayHab services? Is it just DayHab services? Is it community development services, community learning services, et cetera? This is just focused on the dehabilitation services. So each, the different staffing ratios as well as the different size groups in dehabilitation, but it is just focused on the dehabilitation services at this point. We'll go through the productivity factor table, because that's kind of really the biggest difference between the general ledger supplemental data collection template versus just the regular GL template. So I want to highlight some of those key differences. So I'm actually going to flip tabs so you can be looking at, this is the productivity factor data collection table that we will be referring to frequently throughout this training. So this is the primary difference between the GL data collection template and the supplemental template. It's a table that you'll see at the bottom of each of the dehabilitation tabs, and it's where you're going to be entering information about non-billable time related to 4 cost categories: the employment-related expenses, program support, transportation, training, and in addition to those 4 cost categories, you'll also enter information about service closures. And again, this is where you would be entering any non-billable hours and wages. You would be entering them in this table as opposed to filling them in up top. You're still going to enter in this information, any cost information related to the delivery of DayHab services. The biggest difference being you're going to enter in those unbillable hours at the productivity data collection table at the bottom. You'll notice the different colors. The gray is where you should be inputting information. Then the pink is going to automatically total. The gold also automatically totals, but this is also going to pull in information populated up at the top from the billable wages and hours that you would have entered information in for. Let me go back just to highlight a couple more things about the table. The service closures is something that we haven't directly collected before. This has historically been accounted for with publicly available data, but as we're collecting the information for the productivity factor, we wanted to also collect this data from providers. And the service closures are items related to weather closures, power outages, et cetera. If you are a provider and you're concerned that you don't have the data to fill out this table, because DDA is requiring all DayHab providers who provided services in the first half of the fiscal year to fill this out. There is a question here at the bottom of the table that asked if you're unable to fill it out, explain the reason why, and it's a drop-down box. And the first response is, my organization does not have non-billable time to report, or if it's or is the reason that your organization is unable to provide non-billable time and wages broken out? So if you do answer one of this if you do answer this question, it'll actually suffice the requirement for filling this out. You should still be filling out the rest of the information up top. So if you can't break out your non-billable time, we want to know that. And again, if it's that you can't break it out, or if there's just no non-billable time, because that will assist in figuring out the analysis. Okay, so I'm just going to go through the tabs just to highlight each of the tabs in the general ledger supplemental template. It is based off of very closely the GL template. Again, the biggest difference being that productivity factor table at the bottom. I have the instructions pulled up on the screen. I'm going to hit some highlights as I'm going through the other tabs, but so just want to make sure that you know that it's here, as well as there's also a separate standalone document that is a little bit more detailed for the instructions that is also posted on DDA's website. The provider information tab is, again, very similar to the original data collection template. There have been some things that we've added to the template. This is to really gather basic provider information, but as well as some more specifics regarding staffing levels and staffing patterns. So up at the top, it's going to be asking your organization name, as well as specific numbers, including your Medicaid number, or as well as your LTSS number and PCIS2 Medicaid numbers, as well as your DDA provider number. And please note your Medicaid number is what is used to bill Medicaid. It is different than your DDA provider number. And you'll also put in whoever gets the pleasure of filling out the template, if they could put in their name as well as their contact information. Then it goes down to cost allocation methodology for each cost category. So we're interested in how you're coming up with those numbers, because we know different providers could potentially be doing this a bit differently. We also here want to know which billing system you're used, or if you're using both billing systems. So there is a drop-down response for the DDA billing system that's being used. And then the other information gets into the direct support professional levels and wages. So we're looking for the number of DSP staff that are employed during this time period. Some providers may have DSP staff that are broken out by the different levels. We also understand that some providers may not have DSP staff broken out by those levels. If that's the case, if you don't have them broken out by levels, you could just put them all in the first DSP category, which does not have a level associated with it. Then we ask for the average DSP hourly wage. And again, if you have them broken out by levels and there's different hourly wages, we are looking for that information. And then we also want to know some information about your staffing patterns, your average number of hours that you consider full-time at your organization for your DSPs, as well as the part-time hours and what those average number of hours are. And then also the number of full-time employees and part-time employees at the beginning and end of each of the fiscal quarters that we're looking at. Towards the bottom, there is this summary of tabs completed. This will auto-populate based on the tabs that you complete in the template. And once you've filled out the productivity factor table, this will also auto-populate, and it will populate even if you just have to answer the question that you weren't able to fill out that detailed information. I'm going to flip over. This is the cost categories defined tab. And it does go through each of the cost categories. The same 7 cost categories are in this tab. The biggest difference being the cost categories that we're looking at with respect to unbilled time and wages have been highlighted in yellow. So all 7 cost categories, your direct support staff, employment-related expenses, program support, facility cost, transportation, training, and general and administrative are all still on this tab because, again, you'll be filling out the entire template. And then with respect to the productivity factor table, those items have been highlighted in yellow so that you know which items you should be paying attention to put in that table at the bottom of each of the service tabs. So the other items of note, so again, it's dehabilitation services that we're focusing on. There are the different tabs for each of the DAHAB services. So there's a tab for if the staffing ratio is 1-to-1, 2-to-1, if you are providing small group DAHAB services or large group DAHAB services. There is a tab for each. If you are not able to break out your cost and wages by the specific staffing ratio or group sizes, there is this first DAHAB tab referred to as M3 DAHAB, where you could put all of that information together if you're not able to break it out. So I'm gonna flip back just for a moment to the instructions, just to highlight some of the information. We understand that it's a lot on this tab, but just to highlight some of the things that you can find in there. Again, it highlights the time period for the data collection, which is again, the first 6 months of fiscal year 24. It also highlights some of the specific data points that you'll be providing. That includes entering the data into the template for the different geographic region. Again, that hasn't changed from the instructions given for the main data collection template. Again, you'll be entering in information with respect to the specifics, the accounting codes, that description, because different providers could be using different accounting systems. So we would need that description to be included as well. And then again, the hours provided and the wages. Other information that's being requested is the total units and total payments for the services provided, and then the number of unduplicated participants that were served during the reporting period. So this is, again, this is all of the information that's up at the top. If you scroll all the way over, this is where you would be entering in the units and the payments for the services. Down at the bottom is, again, the productivity factor data collection table that needs to be filled out. And then over to the left is the number of unduplicated participants served during the reporting period. And then is the average number of participants served by the day of the week. Once you have completed the template, it can be submitted to Hilltop through the Qualtrics link. That has, and that the Qualtrics link was sent out with the communication that DDA sent out. No templates will be accepted if you send them to our Hilltop DDA rate email address. We will not be able to accept your template that way. You do need to fill out the Qualtrics survey. The Qualtrics survey is very basic. The link is just asking for the name of your organization, your Medicaid number, the contact information for the person submitting the template. Then you'll be able to upload your template. And then we had a number of providers ask about the attestation that is included with the general ledger data, main general ledger data collection template. And by uploading your template and then signing here, which depending on your type of computer or laptop, you can either use your mouse or your finger, and then you would then click on the next, and that would submit your template to us. If you have questions and are looking for additional information, DDA had also sent out links to their website, which I have pulled up on my screen, that you can find additional resources for filling out the information. And again, our Hilltop's email address is on all of the communications that have been sent out. We have this training today. We have another training on the General Ledger Supplemental Template on April 1st. And we are, of course, available by email for specific questions or if you want to set up a meeting with our team. So I'm actually going to go ahead and stop presenting, and I'm going to turn it over to my colleague, Elizabeth Blake, to walk through an example template.
Thank you, Marianne. Okay, I'm going to go ahead and show my screen. Okay, can everybody see the example general ledger template? Yes. Okay, perfect. So Marianne did a great job of running through this instructions tab here and the provider information tab. So I'm not going to spend too much time going over this, but I did want to go ahead and show you what an example template that is completed looks like. So the purpose of this document here really is to accompany that instructions document that is posted on DDA's website. It's really just to give you an example of what a completed template may look like. But just as a small disclaimer before we really dive into this, the expenditures, hours, units, and accounting codes, these are all hypothetical, and they've just been put in here to give some examples of accounting codes and descriptions that will fall into certain cost categories. So this should not be used as a benchmark when you are completing your templates because yours may or may not look similar to this. However, the important aspects like the cost categories, they should be similar to what you all are going to enter into your template. So like I said, Marianne did a great job with the instructions, and then you also have your instructions document, but everything is in here as well. And then just going to that provider information tab, Marianne did a great job of outlining all of the data points that are needed. So if there is anything that you're confused about, you can always go to this example template here and see what a complete one would look like. So we've just entered all of the information, the provider organization information, the information of the person completing the template, and then some of the additional information regarding internal accounting systems, as well as cost allocation methods for each cost category. So then we also have the questions on staffing patterns, levels, and wages, and then two areas at the bottom for feedback on the template itself, and then feedback on the data points that are being collected. So like Marianne said, these are two tables that are going to be a little bit bigger in the template like you saw, but this is a summary of tabs completed, and this is going to auto-populate once you enter information into the respective tab. So it's based on a formula. There's no need for you to manually say yes or no. And we have one for the general information entered into the cost categories, as well as a table for whether or not you've completed the productivity factor collection table. And like Marianne said, whether or not you're actually entering information into the productivity factor table or whether you're answering the question on why you can't complete it, this will pop up as yes. So moving on to the cost category description table. So this tab is going to be really important for you to refer to when you're actually completing your template. So we go through each of the cost categories and define it, as well as provide some examples of items to include and items to exclude, as well as things that we're going to be transitioning to the productivity factor table, and then just additional details on data points that are needed. So as Marianne showed you, some of these are going to be highlighted in yellow, and these items are the ones that we want you to transition to the productivity factor table. So for example, for employment-related expenses, instead of reporting the cost of paid time off and the overtime portion of wages in the ERE category where you normally would have in the general ledger template, you're now going to transition and only report these costs in the ERE portion of the productivity factor table. For program supports, we're asking you to transition the non-billable hours and non-billable wages to the productivity factor data collection table for DSP time spent shopping for and preparing for food related to certain programs or services, DSP time spent setting up and taking down activities, DSP time spent on quality assurance activities like data validation or setting up activities, as well as the share of direct care staff documentation time. So all of those things are no longer going to be reported in the top of the template, which this will all make more sense when I flip to the other tab, and they're only going to be reported in that productivity factor table. For transportation, we are now going to transition and report the share of direct care staff time driving on the clock in the productivity factor table. And then for training, we are going to transition the share of direct care staff time as a new hire training and staff development in the productivity factor table. So these items that are being transitioned into this productivity factor table should only be reported in that table and should not be reported at the top in the cost category boxes that you would have reported them in previously. So let me just go ahead and flip to that table here. So this part of the template, no major changes, minus the fact that we have added in this productivity factor table here at the bottom, like you saw in the actual template. But this is where you're going to be entering in the bulk of the information that we are requesting. So that is really the only thing that has changed. We still have the specific elements of direct care staff, employment related expenses, facility, program support, training, transportation, as well as the general and administrative sections for you to enter in all of that data. Direct care staff, facility, and general and administrative have no items that are being transitioned into the productivity factor data collection table at the bottom. So we're not going to really work through those together today, but if you are interested in more information on these cost categories, you can definitely reference previous training sessions that we've had for the original general ledger template, or just go back to the cost categories define tab, and it should give you a good list of things that should be included. And just as a disclaimer, this list is not exhaustive. We've done our best talking to providers to get as many items included on here as possible, but there still may be things that you have questions about. And as always, please feel free to send us an email to the email that we've provided in the instructions, and we'd be happy to assist you in answering any of those questions. So just like before, it's broken up by geographic differential. We have our rest of state, geographic differential. And then again, like Marianne said, just before we kind of get into all of this data here, we do just want to really highlight that the accounting code description is going to be a lot more important than the actual accounting code that you are reporting. And this is just because you're all going to be using different accounting systems, so the accounting codes are going to vary, which is why we're really asking you to provide that code description for us. So like I said, direct care staff is not going to change. The only thing that has essentially changed about this is what you enter here at the top is going to auto-populate down here in pink. But going into our ERE, so employment-related expenses, this is where we're going to start making some important distinctions. So this is the category where we want to include things like insurance, FICA, unemployment, workers' comp, and medical in the top section up here. And then we are now going to transition into reporting our non-billable hours and non-billable wages into the productivity factor data collection table. So now instead of reporting paid time off and the overtime portion of wages up here, we are going to only report them down here in our productivity factor data collection table, and you're going to enter them right here. You're going to put the non-billable hours, and then you're also going to put the non-billable wages right there. So you're only reporting it once in the template. You're just going to stop reporting it up here and only put it in the table below. And then, like I said, facility has not changed, so we're not going to really go through that, but there's more details on our cost categories defined tab if you're interested in what to include in there. So for the program support cost category, this is where we're going to be entering any costs required to provide services that are specific to the program. So in the top of the general ledger template here, we are looking for things such as program support wages, cost of contracted services, and IT expenses related to program support. And then we're going to transition the cost of DSP time spent shopping for and preparing food related to certain programs and services, DSP time spent setting up and taking down activities, and then the DSP time spent on data validation and other quality assurance activities. And now we are no longer going to be putting them up here, and we're going to just be reporting them down here under program support, right there. So you'll enter the non-billable hours and the non-billable wages. So the next component is going to be our training component. And this will include costs related to staff training, certifications, and things similar to staff development. So what we've included at the top here are third-party training wages, program support training wages, as well as general and administrative training wages. And then moving back down to the productivity factor data collection table, we have training right here. This is where we have transitioned reporting the share of direct care staff time, like new hire training and staff development costs, down to the productivity factor data collection table. So all of those are reported here, and they're no longer reported at the top under training. So the last component that we have that's also included at the top of the template is our transportation cost category, which is going to include costs incurred by transportation staff, transportation time, and other transportation related costs. However, we are now asking for you to report the share of direct care staff time driving on the clock in the productivity factor data collection table below. So what we have at the top here is our vehicle insurance, fuel and fluid expenses, repair and maintenance for the vehicle, and then the cost of tags, titles, and registrations. And then we are going to go back to the productivity factor table here. And this is where we are going to be including the cost and hours of direct care staff driving on the clock in this table. So right here under transportation. So down here looking at this table, the last place that you're going to be asked to enter information is under service closures. So we're asking for the non-billable wages and hours for weather-related or unplanned closure days. So all of this will total up in these pink and gold rows, and will show you, just based on the information that you've entered, the DSP total wages, DSP total hours, and then your average wage for your organization. So if for some reason, like Marianne said, your organization is unable to complete the top of this table here, we're just asking that you pick from the drop-down menu just to indicate the reason why, just so that also when you're looking at your provider information tab, this will populate as yes, and we'll be able to see that you have put something into this table. So, per usual, when you get to the end of the table, we're still asking for you to provide the units for the respective billing system, as well as indicate the total LTSS or PCIS2 payments made, just depending on the service. So this has not changed. And then again, just as you're moving through each of the tabs in your actual template, just a reminder too, once you scroll here, scroll past that, go to the beginning of the sheet and look to see what information we are requiring you to enter here. So this is going to be unique, just depending on the tab you are in. But that is the end of our example template. So I'm going to go ahead and pass it back to Elizabeth Peters just to open up our questions and our discussion. So I can go ahead and stop sharing my screen.
All right, thank you so much. And for everyone listening, we do have a couple of questions so far in the question panel, but as we're going through, if there's anything else that you think of, feel free to add it in here and we will work our way through. So the first question that we have, for the productivity factor collection, we did not track the data for the 3 months we were in PCIS, but we have the data for the 3 months we were in LTSS. What do you advise on how to complete that section?
This is Caleb. If you could enter the LTSS data and make a note saying that it's only for the 3 months when you had the LTSS, I think that would be appropriate. I mean, certainly you can capture both the LTS and the PCIS data in the upper part where that's available. But enter what data you have and make a note of what time periods that covers, please.
Thank you, Caleb. The next question is asking for some clarification. Are we looking for the total number of DSPs or just the DSPs in day habilitation?
For the GLS, we want just the DSPs in day habilitation.
Thank you. For the time off for non-DSP staff, that should be reported above in ERE, correct? Only the DSP time off goes in the productivity tool. Is that correct?
That's correct.
Thank you. The next question we have, how should we answer the question if we can break out some components for non-billable time but not for others?
Yeah, generally submit what data you can, and if you can make a note, we'll make an adjustment on our end. So if you, for example, can break it out for the first two, let us know. Do that, break it out for the first two, and then put a note in there letting us know that. And we'll try to adjust on our analysis for that. The more data, the better. Just let us know, what you're providing. Put zeros for things that you know are zero and leave blank things that you don't know or are not relevant. And if we have additional questions, we may follow up.
Thank you. The next question, can you clarify what exact services are needed for day habilitation, small group, large group, and one-on-one support?
Elizabeth, can you ask for maybe clarification? Because those are the day hub services. That's the breakdown of the different day hub services. I mean, we don't have procedure codes, but we're not quite sure what the question's asking.
They were just looking for clarification if those were the correct ones. And yes, they are. All right, so the next one, how do we separate DSP if we have CDS and day habilitation, as this organization does not currently separate?
We agree that's can be difficult. We know that some providers don't have their data easily separable. So do your best. Explain if you do allocate, if you do some sort of allocation, do your best to explain how you did that in the note. Give us your best estimate and let us know that it is an estimate and how you did it.
And if somebody is not billing in LTSS, is this something that they should still submit?
Yes, any provider who provided services, whether in PCIS2 or LTSS, for the time period should be submitting their data.
We have a question here regarding how to submit the template and asking if people should submit this with the link that's listed on the handout on page 5. And so yes, you'll see on page 5 of the handout, there are links to one, how to submit it, as well as the email for all questions and technical assistance. We also received another question about if this will be recorded, these sessions, and if so, where they will be found. So yes, these sessions, including this one, will be recorded and will be uploaded to the DDA website. And that link is also listed on page 5 of the handout. Next question we have, how should temporary or contract staff providing direct services be entered?
They should be entered. Yeah, go ahead.
So Kim, I can take this one because we've had several questions about this. So contracted staff providing direct support should be included. Their hours and wages should be included in the DSP category. So we would ask that you would treat those staff the same in terms of their unbilled time and included that unbilled time in the productivity factor.
All right, the next question. When and all data from PCIS show as billable, as there is no discrepancy for what can be billed?
I'm not sure I understood the question.
We can get some additional clarification for that question. In the meantime, I'll move to the next one. If we have not billed for any day habilitation services in LTSS or PCIS2 for the time period, who can we confirm with that we do not need to submit the information?
So providers can reach out to Hilltop. We've pulled the billing and payments for that time period. So if there's any question, we're happy to talk with you. And then providers who have concerns about submitting the data, we had a few reach out to us. We will definitely defer to the DDA on decisions for who may, not be required to submit data.
Thank you. Next question that we have is asking for clarification. So if somebody has more accounts than spaces provided, would they be able to insert rows to add that additional information?
Yes, there are actually clarifications in the instructions for if you have to add lines, just making sure you add it above the total so that it doesn't impact the formulas in the template. But we do understand that some providers may have more costs. We tried to allow as much space as possible without making the template overly extended, so that additional lines can be added.
All right, so looks like we received some additional clarification. So providers don't have to bill for specific periods of time under the FPS system and therefore don't have to discern between billable and non-billable time in PCIS. So how would providers determine that that time is unbillable?
So thank you for the clarification, and that's a great question. So if a provider is billing all in PCIS2 and they feel that they don't have any unbilled time, there is that drop down in the productivity table where they could indicate that there was no unbilled time for their organization.
And it looks like we are nearing the end of the question and answer portion of this session. If there are any last minute questions, feel free to put them in the chat and we will get to those as we're wrapping up. In the meantime, while we wait to see if there are any last-minute questions, just as a reminder, this session will be posted to the DDA website where you can go back and view this, and then also all of the resources will be available in the handout portion of this webinar. So if there are any questions, feel free to look at those resources and follow up with our team if necessary. So the last question that we'll answer for today is just looking for some more specific examples of what would be considered non-billable.
So the specific examples for non-billable actually go across the different, categories as we've outlined. So like for ERE, that would be those the paid vacation time as well as the overtime portion of the wages. And in training, for example, it would be the onboarding and any staff development training time that can't be billed for providing services. So really think about just the hours that your direct service staff are working, but not providing any direct service, and then allocating that time across the different categories to capture it accurately, so we can see how it impacts the different components. If you have specific questions, examples that are coming up in your organization, please feel free to email us. If you put something in the template that you have a question about, you can always flag it. As Caleb said, we're looking to get as much data as we can from the providers. And we understand that some things are nuanced and may not fit directly in the categories as we've outlined them. But when you submit it and you flag it for us, if we have questions, we may reach out to have a follow-up discussion so we can make sure it's accounted in the right place. So when we do our analysis, we've accurately captured it.
All right, thank you so much, Kristen. And as we are closing out, that appears to be the end of our questions for now. If folks do have any additional questions as they're going through or need some additional technical assistance, please reach out to Hilltop. Again, the email for that can be found on page 5 of the handout. And I just want to thank you all for tuning in and listening and participating today. And again, on behalf of DDA, extend our sincere appreciation to Hilltop and Optimus as well. So thank you all, and I hope everyone has a wonderful rest of their day.